Today's video, we're talking about DBT, what it is, should you try it, what's it good for, what does it even mean? Today, we're talking about that in plain language, okay? I know a lot of people use a lot of technical jargon or psychological jargon, and it gets all confusing. So today, we're gonna make it really simple for you, and hopefully by the end of the video, you'll know a little bit more about DBT therapy than you did when you first watched it, okay? Now, the first thing is, before we get into that, is to introduce myself. My name is Matt. I'm a therapist in private practice. I own PRGRS Therapy. We are a small mental health practice located in New York City. We do provide virtual care, though, to people all throughout the state of New York. One of our specialties, among others, is DBT therapy. And so that's why I wanted to make this video. Okay, so without further ado, let's actually just jump right in. Look at that. I have my notes here. So we're going to talk about DBT, which I've said 1,000 times. What exactly is it? It stands for Dialectical Behavior Therapy, right? Some people say dialectical behavioral therapy, dialectical behavior therapy, okay? It is an evidence-based approach, right? An evidence-based practice for a variety of different mental health issues. Now, it was developed in the late 70s, early 80s by a person named Dr. Marsha Linehan. She originally developed it to treat borderline personality disorder. However, since then, it has been used to treat a whole variety of different issues. One of them is ADHD. That's another thing we specialize in the practice. It can treat anxiety. It can treat PTSD. There's a lot of different things that it is shown to help with. If you want to look at the different research behind ADHD, behind DBT, then you can go to the Behavioral Tech website, which I'll link down below, which is the official website of DBT, and you can see all the research and all of that, which can inform you about the effectiveness of it for different mental health conditions. But really simply put, it's an evidence-based practice that's shown to help with a variety of different mental health issues. But what exactly does it consist of? Now, I like to think about DBT in two different ways. On one hand, there's a bunch of skills and tools, right? So we kind of have this. DBT is manualized, so there is an entire manual with worksheets and homework and things like that, right? And so there's a bunch of skills that we're able to teach people. I'll get into what those are in just a minute. The other thing is, and this one is kind of like, I don't know how to really word it, but it's more of like an approach, right? So DBT has kind of a framework that a therapist will follow, or kind of an understanding, an undertone, something like that, right? Kind of a foundation from which they will do therapy, okay? And that approach, if we really wanted to simplify it, it's essentially being able to act out of the wise mind, okay? I don't want to go into an entire DBT lesson here, but DBT basically says we have emotions, and if we act out of emotions too much, we'll end up with issues. And then we have our logic, and if we act simply out of logic too much, we'll also run into issues. And so we want to kind of combine the two, which is what they call the wise mind, and basically live life out of this. So that is the approach. The skills and tools will help people do that, okay? Now, this is just a simplified version of what DBT is. And so when it comes to DBT treatment, there's a couple of things that you need to be aware of. There is what we would consider like a DBT program, like an official DBT program, which tends to be very intense. It can be a year and a half. It typically involves group therapy, individual therapy, coaching. It's really intense, right? Now, most people don't do an official DBT program, all right? A lot of people don't offer it, and a lot of people don't need that level of care. But you do need to be aware that there are DBT programs, right, like that. What most people engage in is what I would consider DBT informed, okay? Meaning the therapist has been trained in DBT, is not running a DBT program, but is highly informed by their DBT training. When we do DBT in our practice, it falls under this category, DBT informed, okay? I am someone who got intensive training in DBT, and so everyone who joins the team also gets training in DBT. So when we do work with clients, a lot of times it's going to be this DBT informed approach. This allows for a little bit more flexibility, right? In terms of, there's no one size fits all. We can pick and choose what sections of DBT might be most helpful. We're not on a rigid, structured schedule, right? So that's that, okay? So then what exactly is DBT consisting of? There are 4 main modules in DBT, okay? So we've got DBT, and then we have this, and this is in no order here, and please forgive my spelling. We've got mindfulness, right? And underneath this, we got a whole bunch of skills and tools, all right? We have emotion regulation. Oh, not writing properly here, so I'm gonna scribble that out. And underneath emotion regulation, a whole bunch of skills and tools, right? We have interpersonal effectiveness, all right? A whole bunch of skills and tools, right? And then our final one is going to be distress tolerance, okay? Whole bunch of skills and tools. So these are basically 4 main sections of DBT. Holding up my pen, mindfulness, emotion regulation, interpersonal effectiveness, and distress tolerance. These are pretty self-explanatory titles. And then underneath, we're going to learn a variety of different skills and tools for each one of those. And that's the focus. You can see here, right, just by looking at this, if we're learning a bunch about mindfulness and we're learning skills and tools, right, this is going to really help us be present in the moment, right? Emotion regulation, helping us manage our emotions. Interpersonal effectiveness, our relationships, right? And distress tolerance, those moments of overwhelm, feeling really, really overwhelmed in the moment, right? And again, this is going to teach us a ton of skills and tools that span a huge array of life issues that we might encounter, okay? Now, the other thing about DBT that people really like is that it is fair. Now, again, we can do the program, which is really rigid and structured, but DBT has essentially manualized all of their skills and tools. So when we're teaching something from distress tolerance, we can give you a handout, right? And so people really like that. There are steps to follow. There's handouts that you can read from, right? And it makes it very, very organized. Skills and tools that are often, vague, something like calming down, right? Or distress tolerance, something like that, is now becoming manualized, approachable, and something you can actually practice. So people really enjoy that aspect of it as well. And this is how long have we been talking? 8 minutes. This is a high-level overview of what DBT is. I did not cover everything here. And again, I hope to speak to you in plain language. And if we had to summarize this, DBT stands for Dialectical Behavior Therapy. It is an evidence-based practice and approach that is shown to be effective for a variety of different mental health issues, right? And it is largely skill-based, practical, and actionable, but it does have the theoretical orientation and kind of foundation that a therapist will practice from that consists of helping clients find what's called the wise mind, which is a mix between our emotion mind and our logic mind, bringing them together so that we're considering both emotions and logic when interacting in the daily world. And they feel that if we are able to do that, we're going to live a life that is more effective than if we don't. Okay, I hope that this video was helpful for you. Again, we are therapists who specialize in DBT. If you're interested in those services, you can check out the link down below to our website, read a little bit more about it. But yeah, I hope this video helps you. I hope you found it informative, and hopefully we'll see you in the next video.